NIH is the engine that has produced all these, therapies, all the fantastic therapies you hear about for cancer, for heart disease, and for brain health. And it's scary about what are we going to do if that doesn't happen, if we don't get funded. So I get a certain grant from NIH, and then it's supplemented to the university to support the infrastructure around my laboratory. So that includes, heat and cleaning and. There are hundreds, thousands, tens of thousands of these kids who have mutations in SYNGAP.
How things looked.
Yeah, this was the first time the settings.
Yeah.
So yeah.
So the parents know there's a window of time, right? We think we could probably treat, starting if it's between 2 and 8. They're desperate, we're running out of time, and we're delayed, so that's not a great place to be.
Now I have an office in the School of Public Health, which is about as NIH announces it's going to stop paying its negotiated, contractually obligated indirect costs, and it's going to go down to 15%. I can't work, and the people who work with me cannot work without the indirect support. We need the maintenance people, we need the janitorial staff, we need the utilities. I can't work without heat and air conditioning. Ultimately, we need to realize that indirect costs are just as important to research as direct costs. The research that we do is important because it literally is going to help save lives. It's going to prevent people from dying. In my instance, it's from cancer, but other people do work in cardiovascular disease and diabetes and dementia and Alzheimer's work and HIV. It's going to hurt us at Hopkins. It's going to hurt us nationally in that we're losing good people from the sciences. But the lady with cancer who's being treated right now, that's the one who's being hurt right now.
I mostly study suicide prevention, largely in terms of the roles of opiates and firearms. So by looking into these deaths, figuring out what things might have contributed, what things might have stopped these deaths, we're able to implement those interventions. Without this research, I don't see how we can slow this crisis. I think it's important people realize that, that suicide's a public health crisis. Overdose is a public health crisis. These are things that we can only address through a public health lens. These are things we need to be applying our resources towards. And although they use resources, there's few things that are as valuable as human life. And if we're going to be spending money on something, saving lives seems like a pretty clear winner.